very good meeting. ನಾವು ಗೌರ್ಮೆಂಟ್ ಆಫ್ ಇಂಡಿಯಾ ರೆಪ್ರೆಸೆಂಟೇಟಿವ್ಸ್, ನ್ಯಾಷನಲ್ ರೂರಲ್ ಹೆಲ್ತ್ ಮಿಷನ್ ಅವರ ರೆಪ್ರೆಸೆಂಟೇಟಿವ್ ಜೊತೆ ಮಾತುಕತೆ ನಡೆಸಿ, ನೀವು ಹೇಳಿದಂಗೆ ರೂರಲ್ ಏರಿಯಾ ಪ್ರೈಮರಿ ಹೆಲ್ತ್ ಕೇರ್ ಸೆಂಟರ್ ಡಿಸ್ಟ್ರಿಕ್ಟ್ ಲೆವೆಲ್ ಇರ್ಬೋದು, ವಿಲೇಜಲ್ಲಿ ಇರ್ಬೋದು, ಅಲ್ಲಿ ಬರುವಂಥ ಮಕ್ಕಳಿಗೆ ಕರೆಕ್ಟಾಗಿ ಟೈಮ್ಲಿ ಕೇರ್ ಹೆಂಗೆ ಕೊಡೋದು, ಹೌ ಡು ಯು ಮೇಕ್ ಶೂರ್ ದ್ಯಾಟ್ ದೇ ಆರ್ ಟ್ರೈನ್ ಟು ಐಡೆಂಟಿಫೈ ಸಿಕ್ ಚಿಲ್ಡ್ರನ್ ಆ್ಯಂಡ್ ಮೇಕ್ ಶೂರ್ ಟೈಮ್ಲಿ ಕೇರ್ ಇಸ್ ಗಿವನ್. ಆ ಬಗ್ಗೆ ಆಲ್ರೆಡಿ ಮಾತುಕತೆ ನಡೀತಾ ಇದೆ. ಆ್ಯಂಡ್ ಹೋಪ್ಫುಲಿ ವಿ ಶುಡ್ ಬಿ ಏಬಲ್ ಟು ಒಂದೆರಡು ಪ್ರೋಗ್ರಾಮ್ ನಾವು ಆ್ಯಕ್ಚುಲಿ ಸರ್ಗೂರು ಇಂಥ ವಿಲೇಜ್ಗಳಲ್ಲಿ ಹೋಗಿ ಮಾಡಿದ್ದೀವಿ. ಆ್ಯಂಡ್ ವಿ ಹವ್ ಫೌಂಡ್ ಔಟ್ ದಟ್ ಇಟ್ಸ್ ವೆರಿ ಇಟ್ ಹಸ್ ಬಿನ್ ವೆರಿ ಸಕ್ಸಸ್ಫುಲ್. ಸೊ ಇಂಥ ಪ್ರೋಗ್ರಾಮ್ಗಳನ್ನು ನಾವು ವಿ ಆರ್ ಟ್ರೈಂಗ್ ಟು ರೋಲ್ ಔಟ್ ಇನ್ ಅ ಲಾರ್ಜರ್ ವೇ ಬೈ ವರ್ಕಿಂಗ್ ವಿತ್ ದ ಗವರ್ಮೆಂಟ್. ಪೇರೆಂಟ್ಸಿಗೂ ಈಗ ಕೆಲವು ಪೇರೆಂಟ್ಸ್ಗಳು ತುಂಬ ಸಿಕ್ ಮಕ್ಕಳನ್ನ ಮನೇಲಿ ಇಟ್ಕೊಂಡ್ರೆ ಅದು ಹೇಗೆ ಟ್ರೈನಿಂಗ್ ಮಾಡೋದು, ಅದಕ್ಕೆಲ್ಲ ನಾವು ಸ್ಪ್ರೆಡ್ ಮಾಡ್ತಾನೆ ಇದ್ದೀವಿ. ಈಗ ಸದ್ಯಕ್ಕಿರೋ ಪ್ಲ್ಯಾನ್ ಏನಂತಂದರೆ, ಇನ್ನೊಂದು ನೋಡಿ, ನಾವು ದೊಡ್ಡ ದೊಡ್ಡ ಆಡಿಟೋರಿಯಮಲ್ಲಿ ಕಲಿಸ್ಬೋದು, ಬಟ್ ಅದು ಅವರ ಏರಿಯಾಗೆ ಹೋಗಿ ಟ್ರೈನಿಂಗ್ ಕೆಲಸ ಮಾಡೋವಾಗ ಕಷ್ಟ ಆಗುತ್ತೆ. ಸೊ ಆ ಏರಿಯಾಗೆ ಹೋಗಿ ಅಲ್ಲಿ ಜನರನ್ನು ಐಡೆಂಟಿಫೈ ಮಾಡಿ ಅಲ್ಲೇ ಆನ್ ಗೋಯಿಂಗ್ ಟ್ರೈನಿಂಗ್, ಖಾಲಿ ಒಂದೇ ಟ್ರೈನಿಂಗ್ ಅಲ್ಲ, ಅದು ಆ ಟ್ರೈನಿಂಗ್ ಕೊಟ್ಟು ಫಾಲೋ ಅಪ್ ಕೊಟ್ಟು ಮಾಡೋ ಪ್ಲ್ಯಾನು ನಡೀತಾ ಇದೆ. ಹೋಪ್ಫುಲಿ ದಟ್ ಶುಡ್ ಹ್ಯಾಪನ್ ವೆರಿ ಸೂನ್. I'll also request Dr. Vinay Nadkarni. Dr. Vinay Nadkarni, for many years, he's been working in this field of resuscitation. But in the field of simulation, he has been instrumental in setting up many programs across the world, including many developing countries.
Even though we have trained many champions, many experts on the skills of resuscitation, we have not been able to translate and transform the way it's delivered so it actually improves survival outcomes. For the first time, PediSTARS is a group of dedicated individuals from India for India. And they have put together a team that is training the individual, training the team, and training the environment so that it reaches in Bengaluru, in the big city, where there are a lot of resources, all the way through the different phases, all the way to the village. It's not a single training tool. It's not like our old courses. It's a completely new way of thinking about things. Because you're right, just sending more doctors to the clinics or trying to force them to go there is not working. In fact, PediSTARS met with the largest ambulance service in the country, EMRI, yesterday at their national training facility. And we have also been to the National Rural Health Mission training facility with EMRI. We also met with the World Health Organization. They met with the Bill Gates Foundation. They met with JPIGO, the nursing organization that can actually implement down to the village level, trying to think and brainstorm and train so we can make one step forward. The STEP program, simulation training for emergency pediatrics, is one small step on the way to solving the problem.
Majority of our training has happened in government medical colleges in India. We have worked in government colleges and hospitals for almost 10 years of our life, and then we have gradually gone up in our careers as such. But the feel for the population and for our country is still there, and simulation is one way which we feel very strongly about, that it seems to be working. It seems to be working very well. As doctors in the intensive care, in the emergency for the last 15 years, we feel that this is one training tool which is going to bring about complete transformation and result-oriented approach towards treating children. It is not theory, it is not books, it is not something which they read and cannot apply. This is real. So as doctors get more real towards handling these life-threatening issues, the outcomes automatically become better. Okay? In a busy ICU like ours, where we see around 50 to 60 admissions in a month, and 5 to 6 emergencies every single day. Not only senior doctors, junior doctors also, doctors, adult doctors working in the emergency, the paramedics, physiotherapists, nurses, everybody has to be equally trained, and they should speak the same language, understand the same way the situation as it occurs. So that is what makes a great team, and simulation is one big way forward towards that. And that's why we are so enrolled, we're so happy to associate with PediSTARS, that we are having this workshop now. We are going to have a training center in situ for all our doctors and doctors surrounding here. Today doctors have come from Tumkur, Chitradurga, Hiriyur, Madanapalli, Anantapur, Bijapur, Bidar, from all smaller towns, to just get the feel of things. We will send them there, we will go there, start training them in their institutes, start training them, and then the next chain reaction starts that way. Right?
Well, PediSTARS has made it very easy for us to come from the United States, from New Zealand, from all over the world to help support PediSTARS as they transform the way we learn and care for patients. It's a big job. It's almost an impossible task, but they've started as volunteers. They've developed a unique new methodology, and they're now starting to train the trainers to create a step effect that's going to affect the country. It has been started about 2 years ago when PediSTARS formed and looked outside for support. And they have trained themselves, and now they have come back to India, and they are starting to roll out a train the trainer program and workshops and care that is getting better and better. It has every possibility to change and save lives. And many people say that the most important thing is saving lives, not just training. Just like in India, in the United States, we doubted simulation education and simulation-based education's impact. Would it really make a difference? We believed in our standard medical school, nursing school training. We thought we did a very good job, and we did. We created many, many good doctors and nurses who did good things and had a lot of knowledge and skills. But when we actually measured from our patient care and our outcomes how we were doing, we found there were many errors and many safety problems that couldn't be solved by training the way we did, just harder and longer. So we started to use simulation-based education maybe almost 10 years ago. And as we measured the outcomes, we were surprised, we were pleased to find that when it was done and done well, we started to see amazing improvements. In my hospital alone, for cardiac arrest, the worst emergency that we have to approach, and trauma care, we saw a doubling of intact neurologic survival after cardiac arrest, something we thought we would never see. In fact, when we looked at many of our problems in our hospitals, like central line infections, complications from insertion of invasive procedures, we could reduce the complications by half. Not by just training skills, but by training in teams. By taking a team of champions, really high-performing individuals, and helping them learn to become a championship team working together.
Your name?
My name is Vinay Nadkarni, doctor. I'm from Children's Hospital of Philadelphia in the United States. Thank you.
Yeah, I think it is very important, right? Because there is very little what you can actually learn from a textbook, and oftentimes that knowledge translation is a problem. What we know to be implemented at the bedside is a big challenge. It is like cricketers, the way play practice matches. So they have practice matches before they play a World Cup or any of the major events. They do play a practice match among themselves. Why do they play a practice match? That's an important question, right? So they are all very experienced cricketers. People like Rahul Dravid, Virat Kohli have spent their whole life playing cricket. So that similar kind of concept of match practice before you actually play a game, that is what a concept we are trying to get to medicine. We are trying to get a concept of getting this practice before you manage an emergency, before you operate a complicated child, so that when you actually go and handle a very sick child, you are much better prepared mentally. So you react much better. So what we try to do here is we take these dolls, and these dolls are, they can blink, they can open, they can breathe, you can feel the pulse, and then they can be connected to the monitor. And by recreating a real experience, making it feel like a real child, with the common emergencies like breathing problems, like low blood pressure, might be like coma, like might be fits. What we try to we recreate those in those babies, and then we work like a team. Remember, no matter how great you are, you're only effective as how good your team is. Sachin Tendulkar could be great, but ultimately victory is not for Sachin Tendulkar, it's for India. So similarly, the victory is for a child. It does not happen from one individual. We have to work as a team. That's what we realize, and that's the whole idea behind what we're trying to do today, is try to see how we can work effectively as a team and make sure that knowledge which is there in the team gets translated for child's benefit. Yeah, so you're right. What we're trying to focus is in the time of crisis, in the time where every second matters in a child. For example, low blood pressure. If you don't treat blood pressure well, it's a matter of hours that the child might lose a life. So it becomes very important that treatment is given in a timely fashion and appropriate treatment is given, and that is what we are trying to achieve, where the time is a crunch, where there is so much of stress, where the pressure to do correct things is very high. We try to recreate them so that when you come across such kind of situation, you are much better prepared to handle those. My name is, I'm Dr. Rakshay Shetty. I work as a pediatric intensivist at Rainbow Children's Hospital, Marathalli.
So, I don't know if you did it purposefully or not, so I'm just curious. You gave her an update and it seems to be in the SBAR format. So our summary is until you see the rate of
whenever we have to start and stop the flow is not clear.
Any other highlights from the observers?
Not
baby was crying, or baby crying, baby not necessarily the cardiovascular at all. See, that's
and using temperature, and she hasn't passed urine since yesterday. So she's just come to your
She was on any infusions, madam, because she's been transferred from a hospital.
Yeah.
She's on any ongoing infusions.
She was getting something,
but doesn't have any documentation of the sister, please. She's around 5. So they just give So the sister, did we get the PBG report? History of acute gastroenteritis. The child has been admitted since 2 days in another hospital, but she's not passed urine since 24 hours. On arrival, heart rate was so saturation was 98%. So just given potassium was 6.8 as
better will start insulin glucose infusion. Take one
position the date.
get the adrenaline system. You give the bag.
0.5.
Start bagging. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
Along with bonus.
Bag.
Not the salary bonus.
Bag.
Yes.
1, 2,